Electrolyte disturbance, hypocalcemia and hypercalcemia. In this session, we will talk about the ECG sign of hypo and hypercalcemia. Hypocalcemia will alter the QT interval. The corrugated QT interval in women less than 450 milliseconds, while in men is less than 460 milliseconds. In hypocalcemia, the QT interval is prolonged without the alteration of either the shape of the width of the T wave, but the way of the ST segment is prolonged. Arrhythmias occurs rarely. Those at the point may occur, but this is much more common in the next tracing. This rate is rhythmic one. The heart rate is normal, around 90 beats per minute. We do have sinus impulse formation. P is positive lead number 2, negative AVR. PR is normal. QRS is narrow. The axis is normal. It's around 50 degrees. Looking at for the pathological Q wave, we do not have any pathological Q wave. Looking at the R propagation in the chest is fine. Looking at the ST segment, the ST segment is okay. Looking at, however, the QT interval, that you can see that is elongated. It's about 500 milliseconds. So that can be the sign of hypocalcemia. In hypercalcemia, the QT interval is shortening. And in severe hypercalcemia, an Osborn wave, a little notch at the end of the QRS complex, will appear. This is called the J waves. In extremely high calcium concentration, ventricular excitability increases and ventricular fibrillation may develop. In the next ECG tracing, we do see that is rhythmic. The heart rate is around 80 beats per minute. We do have sinus P wave, and the P is a little bit flat. The PR interval is lengthened, as you see here. The QRS complex looks like wide, but it's not wide. It's only the J wave or the Osborn sign can be seen here. This is why it's not widened. The axis is extremely right deviated. And looking at the QT interval is very, very short. So this can be the sign of a hypercalcemia. But looking at, for example, for the pathologic Q wave, we do see one in lead number 1 and AVL with ST elevation, so that could indicate a acute high lateral myocardial. In another case, when we do have an increased calcium concentration, again the rate is rhythmic. It is sinus. The P is normal, PR is normal. The QRS is 1, 2, 3 minutes. It's the border line, but let's see, it's widened. The axis is normal, it's around 60 degrees. Pathological Q wave, none. Hypertrophy, none. And we do see a notching of the QRS complex, the end of the QRS complex, as the arrow shows. So that's the hypercalcemia with the Osborn sign, Osborn waves. Osborn wave usually seen in hypothermia. However, this is not diagnostic for hypothermia when the core temperature is less than 30 degrees. J waves can occur as a normal variant. In hypercalcemia, as we discussed before, drug can induce, and intracranial hypertension or subarachnoidal hemorrhage can cause these Osborn waves.